Hi guys, here again with the final part of the lecture. I hope I'm not blurry, it looks blurry, that involves the pregnant woman. And this was done by a colleague of mine in Boston, and it is very well done. In fact, I would encourage you to keep it for your maternity rotation. In fact, you might even see it again. I'm going to go through and pick out the salient points that I think you need to know at this level, and then you can concentrate on those. So I'm going to share my screen, and this should be relatively quick for you. And so this is assessing the pregnant and postpartum patient. Oopsie, sorry. Okay. So again, I'm going to just pick up the salient parts, but remember, we're talking about the health history. We're talking about health assessment in this class, right? So the subjective, the questions that are important to focus in on a woman of a childbearing age and who's also pregnant and postpartum. We want to appreciate the vital sign variations and the physiological changes that are experienced in pregnancy. So she did much the same as I do, only I encompass it all in a Sharp Meds and want you to and present the common symptoms, but she's done it kind of actually out for you. So this again is just everything that's included in the Sharp Meds. Of course, the O, which I usually do obstetric, occupational, you can include obstetric history here as well. These are all things that are very important when you're talking to a woman of childbearing age. So again, she does the demographic data. This is the biographical part. Don't forget about the functional assessment here too, because remember, a pregnant woman develops certain lordosis and kyphosis, so we'll get to that a little bit later. And you want to know about her chief concern. Why is she presenting today? Is she pregnant? Was it planned? When was the date of her last menstrual period? Again, family history, social history, very, very, very important. And you want to look for signs, always look for signs of abuse, smoking, drug abuse, any kind of domestic abuse of any sort. But again, you're kind of reading your patient, that therapeutic communication, and watching the verbal and the nonverbal cues, as well as your assessment and skin assessment as well. So again, see, same categories. These are past medical history, kinds of history that you want to focus in on a woman of childbearing age or who is pregnant or postpartum. And this is very important as well. So the gynecological history, you do need to pay attention to the age of menarche, which is the onset of menstruation, length of her cycle, duration of her flow, how comfortable or uncomfortable she is, breath self-exam. Does she take birth control? What does she take? When did she last take it? Any history of urinary incontinence, right? Because if they're pregnant with the weight of the baby, we're going to have that problems. We may have that problem when they're pregnant. Often pregnant women end up having to go to the bathroom quite often because of the pressure of the baby on the bladder. And then you have previous histories, the GTPAL, that stands for gravida, term, preterm abortion, and living or live births. So these are all very important, okay? I want you to appreciate the types of things that you need to get in a history. Do not feel the need to memorize at this point, okay? Remember, this is more of an introduction. And these are the types of review of systems. You know, I don't limit myself review of systems on any patient, pregnant or otherwise. I'm going to go over in their first physical all review systems from head to toe. But you do want to be sensitive to these areas of neurologic, HENT, GI areas, genital urinary and extremities and skin, and also in the skin look for any kind of bruising or evidence of abuse. Vital signs, good to know. Again, am I going to test you on that specifically? No. Understand that there are changes in the body that occur. First trimester, generally, your vital signs, blood pressure stays about the same pre-pregnancy. Second trimester, you might get a little bit of decrease, which is interesting. And in third trimester, it returns to normal. However, people do end up going into, some people do end up going into preeclampsia, which raises the blood pressure, which is an emergency. Certainly critical to monitor and can be an emergency. And you can understand why the respiratory rate might be slightly increased, right? Because the body, the abdomen or the pelvis, the weight of the body, the belly is starting to consume more area in the abdomen. So as the diaphragm, drops down when you take a deep breath in, actually raises up and goes down, you have less total area, right? So you may feel, pregnant women may feel a shorter breath, and a slightly shorter breath, and that may increase as the baby begins to grow. So this, again, I'm not going to test you on this specifically. Certainly underweight is always under less than 18.5 for a BMI. This BMI is pretty much normal. That's normal. But this is basically telling you by your underweight pre-pregnancy, how much weight is expected to be gained. Having said that, it's very variable. I can tell you I gained 50 pounds with my first child, 40 pounds with my second child, 30 pounds with my third child, and 18 pounds with my fourth child. And the fourth child, I gained 10 of those pounds in the last week from fluid, and they took the baby early. So I was very, very sick with my fourth child. I had that hyperemesis gravidarum. It's not fun. And therefore, my last child. What I do want you to know, some key words. I want you to know what the linea nigra is, the melasma. So the linea nigra is this first picture to your right with the line down the center of the abdomen, and the melasma is on the face. It's kind of a mask-like feces. And then striae gravidarum, well, that unfortunately is stretch marks that you get from the growing abdomen. And also we know what acne is, right? Hirsutism is an increased growth of hair, and it can occur because of the hormonal changes. And your nails can become soft and brittle. So these are kind of the health assessment, basic health assessment things that I think you should be aware of and knowledgeable of. While pregnant, patients can develop an inflammation of the gum known as gingivitis, and that can cause some bleeding, as you can see over the picture. Just remember that picture and say to yourself, that's what gingivitis looks like, and can be more common in the pregnant woman. Breast changes definitely occur, and also something, your basic health assessment, you should know. You will understand that the breast enlarges, and the areola can enlarge and darken, and you can start, the pregnant breast can start developing colostrum, which is that thin, milky, clearish, milky drainage that comes from the breast. And that is what the baby, nursing baby gets in the first 3 days, because that's all that comes out of the breast at that time until the milk flows, and that colostrum is rich with elements protective for the baby and during that early stage. So here you go, respiratory system, right? Increased level of progesterone and relaxin. I'm not going to test you on that. Diaphragm is lifted up about 4 centimeters, which can put some stress on the respiratory system and cause some respiratory, like shortness of breath. The increase in blood plasma levels, this is because, you have a baby growing in, right? Cardiac output increases, again, because you have a baby growing inside. Hormonal changes can result in sodium retention. Sodium retention can cause swelling. It can cause heart enlargement, systolic murmurs, lower extremity edema. These are in your basic health assessment knowledge base that you should know. GI, hemorrhoids and constipation, very common. Slowing because of the hormones, which is slowing of the peristalsis, causing constipation, and there's pressure of the weight from the weight of the uterus on these organs. So same with the urinary system, compressing the bladder and the ureters, causing urinary frequency. You may notice women may have more risk of urinary tract infections, especially if they're diabetic. So I am not going to test you on this slide, but it's super interesting, and if you're so inclined, look at it, read about it, see how it happens. It's just amazing, I think, and it never ceases to amazes me. But again, you want to save this lecture for your maternity rotation and your peds rotation, and you can see how the uterus is growing throughout the pregnancy from 12 weeks to 20 weeks to 38 and 48 weeks. Tie this, when you are held to this information, tie this information to various people at different times in their pregnancy, so you can imagine what's happening with the uterus at that time. In other words, at 20 weeks, the uterus is measured with each prenatal visit, and it increases in size about until 38 to 40 weeks. When is the fetal heart rate noticed? 10 to 12. Some people can hear 8 weeks, most 10 to 12 weeks. I wouldn't worry about the Leopold maneuver. You'll hear more about that in maternity. Anyways, this is more of an interesting slide for you. Just understand when women are pregnant, obviously the uterus is growing in size throughout the pregnancy. This is an important slide for you now. What impact does pregnancy have on the musculoskeletal system due to results of hormonal changes in the growth of the fetus, as well as the maternal weight gain, which is the mother's weight gain? And, as the pregnancy continues, the uterus will tilt the pelvis forward, like this. The breasts are enlarging. That pulls the shoulders forward. The added weight, and the pelvic joints and ligaments are relaxed due to hormonal changes. So when we learned in neurology the shape of the spine, we know that there's a natural lumbar lordosis, but in pregnancy it becomes much more pronounced lordosis, right? You can notice a stooped shoulder stance because of the weight of the breast. And obviously, balance might be a problem for these women. All of a sudden, they're carrying this growing baby. They're having to adjust to a different changes in their body, and they might be more at risk to fall. And they might, as the bigger they get, become known as the pregnancy gait, which is kind of the waddling factor that happens. So that's very important for this class, okay? Sometimes you notice a kyphosis here, which is, a bump back here, and then sometimes you notice down the lower lumbar region or lordosis, well, not sometimes, always, okay? You can see the bump on the second picture of the woman where she's a little bit further along. Kyphosis is toward the neck and upper shoulders, and the lordosis is in the belly range. You can see the impact on the spine there. So that's an important slide. Okay, pregnancy, mood changes, huge, right? Because of the hormonal swings. So be kind to your spouses, to your patients. Educate patients and family members and spouses and partners that it's not uncommon for all of a sudden something that would never have bothered a woman before, all of a sudden they're going to be break it down in tears. The reproductive system, I'm not going to get into this for this exam, but it's very interesting. It's good for you to learn, actually read and be introduced to this material now, because you will be responsible as you move forward. I believe is it next semester or the following semester? Post delivery, the uterus starts to involute again, and it starts at 24 hours after delivery, and it returns to normal size 6 to 8 weeks of delivery, at post delivery. So very often patients, moms still look pregnant, it just maybe a little less so after delivery. That's normal, that will decrease. And they do measure, nurses, they do measure where the uterus is by measuring finger breaths below the umbilicus. The discharge will occur as the sloughing off of the uterine lining or the endometrium, and that can go up to 6 weeks, and they call it discharge lochia, which is also includes bleeding. Lactation, breasts usually begin to feel full and tense around the 3rd to 5th day. In the meantime, they are putting out colostrum. Breasts can become engorged, which means they can become filled with, usually once the milk comes in, it can come in fast and heavy, and the breast can be very engorged, very tender, firm, and it actually, you have to express the milk to get relief. If someone is not going to nurse, then they can use ice packs and so forth, ice or heat, whatever makes them feel better. I think a lot of nurses do ice packs. But so the breast milk forms in response to the declining hormones post-delivery of the placenta. So we already talked about the GI system and its effects. You do expect to still see, feel bowel sounds, right? You expect to see that, and you want to see that. Skin, we already talked about these. The diastasis recti is down the center of the abdomen, and it's where the musculature starts to separate. And if they are getting up from a lying position, and they come forward and you watch their abdomen, you can actually see a separation. While this may be a little unsightly, it does bother some people. We rarely ever fix it. The risks of damage or complications from surgery is much greater than leaving it there is no harm. Bubbles he, or bubble she, I like to call it, postpartum assessment. This is kind of a mnemonic for your benefit. I'm not going to test on it at this point. And that's it. So, basically what I want you to look for here is appreciation of the pregnancy changes from a pre-pregnancy state to pregnancy, and how it occurs over time throughout the pregnancy as the baby grows. And, the things that I called out to you, the certain terminology and stuff that I said that is very important for this course, that is stuff that you want to know for sure. So that is it for that. This, I believe, is probably the shortest of all the lectures. And I hope you find me divvying up these videos so that you can break them up in time helpful to you. I really would like that feedback to know one way or the other. I'm really hoping that I get back for the next lecture, which is on substance abuse, but if not, I will have it videotaped as well, and I am determined to be back for your final lecture so I can help you wrap up for the final. And if I don't see you the week of Thanksgiving, I hope you all have a wonderful Thanksgiving, and no worries. Take your head to toe one by one. You will be fine, and you're almost done with this class. Take care and happy Thanksgiving.